threw up once today, so
It took Parish Glass and her husband 4 years and thousands of dollars to conceive a baby through in vitro fertilization. Now, at long last, the Navy couple is expecting a boy in August. But since they conceived during a global pandemic, they're facing the question of whether Glass should get a vaccine.
my OBGYN said, it's definitely okay, go ahead and get it. But for us, this has been a 4-year journey of infertility, and we've spent so much money and so much emotion and just physically draining time into this process. And so, with this one shot that we have, it is a huge question of, do we want to risk it?
To be clear, doctors and medical experts agree that the COVID-19 vaccines are likely safe for pregnant women. Yet, Glass still isn't convinced.
For us, because there isn't enough data, we'll let other people be those guinea pigs for us.
The reason for the dearth of data is simple. Pregnant and breastfeeding women are almost always excluded from drug trials, and the COVID-19 vaccine trials are no exception. Some medical experts say this was a mistake, especially when considering pregnant women are at more risk for serious cases.
I think we could have carefully and thoughtfully included them, but I think that ship has now sailed.
Dr. Denise Jameson is a member of the COVID-19 expert group with the American College of Obstetrics and Gynecology. She says there are plans to do clinical trials specifically for pregnant women.
I think the issue is now that the vaccine is becoming more and more available, it's harder and harder to justify enrolling a pregnant woman in a trial.
That's because those women might get a placebo. While no COVID-19 vaccines were purposefully tested on pregnant women, there is some data available from women who entered trials before they knew they were pregnant and from testing on animals. No significant adverse side effects were found in either case. Also, it's important to note that pregnant women are strongly recommended to receive other vaccines, like the flu shot and the whooping cough vaccine.
I highly recommend it to my patients.
Dr. Joanna Adamczak specializes in high-risk pregnancies and is the chief medical officer of Sharp Mary Birch. She says refusing the vaccine is the greater risk for pregnant women.
These ladies do get more sick. They have higher rates of ICU admissions, they have higher rates of hospitalizations, not to mention the fact that it can lead to preterm labor.
That reality is visible every day for Dr. Becky Adami, a maternal fetal medicine specialist at Rady Children's Hospital who has been treating pregnant women with COVID-19.
Personally, I've seen patients who are admitted to the ICU who are intubated in pregnancy, and that it can be really scary. I mean, we know that there's a higher risk of mortality. And seeing that those maternal effects definitely, make me think it's definitely thing to be vaccinated to protect yourself.
Any nausea?
No,
No?
life is good.
Adami is pregnant herself, and when the call came in mid-December offering her a COVID-19 vaccine dose, she didn't hesitate.
That's when I got the call that it was available, and I said I will come in that day and get it.
But some women who don't work in healthcare and believe they aren't at risk of getting COVID-19 are opting to wait until after they deliver to get the vaccine. Alicia Temby, a teacher at a private school in Encinitas, could be eligible for the vaccine soon, but says she'll wait until after she delivers her baby in April.
I am pro vaccine in general. And backstory, like my dad had polio, and so I definitely am pro vaccine. But I also am very data driven, and there's no clinical trial data showing that the COVID-19 vaccine for any of the manufacturers is safe to take because there is no clinical trial data yet. So that definitely makes me pause and say, okay, what are the benefits and risks? And if there's no one that can tell me that there are no risks, then I'm just going to wait.
In fact, even after she delivers, she's not sure she'd take the vaccine because of concerns over breastfeeding. We'll hear more about that tomorrow. Claire Tragesersays, KPBS News.